Pat O'Halloran has always been healthy and active, but that changed last year when she started experiencing severe pain. Her doctor sent her for an assessment.
And of course the result was immediately, yes, you're bone on bone, you have severe osteoarthritis, you do need a hip replacement.
Pat had her surgery at Sunnybrook's Holland Orthopedic and Arthritic Center, and for the first time in her life was told to take strong opioid painkillers.
You hear horror stories about people becoming totally addicted to pain meds. So I thought, well, I don't want that to happen to me.
So the idea is that the nurse will bring pills for you.
Patients wary of medications following hip surgery is common, says Dr. Chris Idestrope, site chief for the Department of Anesthesia at the Holland Center. But he says some patients might need to take opioid drugs up to 6 weeks to help physiotherapy efforts during rehabilitation.
If we can't control their pain, generally within the first few days, such that they can do their physio and their rehab, then it's an indicator that they may have challenges down the road.
Show me what you can do, as far as you can go.
Daily physiotherapy is a critical part of a patient's recovery. Advanced practice physiotherapist Susan Robarts says medications make that possible.
Just to take something so that they can continue to push their exercises and push their function. Because if they don't, at 6 months, a year, they'll still be stiff. They'll still have weak hip muscles.
Not only does that affect quality of life, but it also puts patients at risk for falls, which can be catastrophic. About 1 in 100 patients might experience a problem with addiction while taking opioids following hip replacement, Dr. Idestrope says. The healthcare team watches closely for signs of trouble, like if the need for medication does not decrease over time. At the Holland Center, patients are given pain medications at the bedside and left to decide how much they need. Studies have found that this style of self-care has actually decreased the use of opioid drugs following surgery. After returning home, Pat called her healthcare team to discuss her medication concerns and was reassured.
And it worked out really well, so I'm thrilled that I did take my medication, so I was able to do my physiotherapy, and then I was able also to stop taking the medication afterwards.
She's now back to doing everything she loves, living actively without pills or pain. With Sunnyview, I'm Monica Mattis.